Welcome back to Another Thing. I'm Larry Mendte. Flu season comes around every year. Every year it's easy to get a flu shot, and still people don't. To re-emphasize the point that you should, meet Shannon Davila, who is the director of the Institute for Quality and Patient Safety. She is also an infection prevention specialist at New Jersey Hospital Association. Thank you so much for being here.
Thank you for having me.
Every year we hear about the flu and how important it is to get a flu shot, and still people don't get their flu shot. What are the reasons you get or you hear for not getting the flu shot?
I think some of the common reasons that we hear, folks are unsure if the flu shot is going to be effective. And certainly, with the internet and, different social media, sometimes folks may get mixed messages about the effectiveness of the flu shot.
I understand there's science behind it, but there still is a little bit of guesswork, isn't there?
Yeah, absolutely. And fortunately, there are federal committees that look at the research every year. They look at the predominant strains from the year before, and they're able to match up the predominant strains of the flu with the vaccines that are available. So, for example, for this year, there is a high likelihood that the vaccine is going to be effective for the circulating strains.
But don't they think that every year? And I don't mean to throw a wet blanket on it, but you really don't know until the flu season starts.
Sure,
right?
and there's not a 100% guarantee that the vaccine is going to protect you. But what I can tell you is that getting the vaccine will reduce your chances of getting the flu. And of course, there's always the opportunity that the strain that you become exposed to may not be covered by your vaccine, but still getting the vaccine will help reduce the effect of that flu.
What about the people that say, I got the flu shot and then I got the flu right afterwards?
Mm-hmm. So we hear that a lot, and the truth is that you cannot get the flu from the flu shot. Lots of folks will get side effects from the flu shot, and those are generally mild. You may get redness, soreness, or swelling at the injection site. Sometimes people will get a slight fever or maybe a little bit of achiness, but generally the symptoms are very mild and they resolve within 1 to 2 days. But it's important to remember that the benefits of getting that flu shot will last you throughout the entire flu season versus the risk of perhaps having a mild side effect.
And I know you would argue everyone should get a flu shot, but there are some groups, there are some people where it's an absolute necessity.
Infants, as well as pregnant women, adults with chronic conditions, so folks with asthma or diabetes, and then the very elderly. But it's also important to remember that even if you're not a high-risk individual, but you live with someone who's high risk or you care for someone who's high risk, you should also get your flu shot. And that's not just to protect yourself, but it's to protect those individuals. So, for example, healthcare workers should all get vaccinated to take care of their patients.
But they're probably pushed to. They're probably when they show up at work, they have the flu shot. It is amazing how widely it is offered now. When you go to the pharmacy, it's there. Sometimes when you go to the supermarket, it's there, and still people don't do it. We were just having the conversation that I have a son with asthma, and you were saying absolutely he has to get a flu shot.
Sure, and there's really so many opportunities to get your flu shot these days. You can call your primary care provider and make an appointment. Many pediatrician offices offer clinics where you can just go in and have your child vaccinated. A lot of the local pharmacies have walk-in services where you can go and you can receive your flu shot from a pharmacist. And many employers offer flu shots, which is really convenient, and usually it's free. You just need to talk to the health department at your employer and to find out when those flu shots will be offered.
It seems like because it happens every year, because the flu is so common, we don't take it seriously. I was talking to you before about, on the news we always cover the disease of the week, SARS, mad cow disease, West Nile virus, so many things that aren't as dangerous as the flu is that gets more coverage. I would imagine you'd like it to be a story every flu season.
Absolutely, and we certainly want folks to understand the urgency, and unfortunately sometimes it doesn't really occur to people until they become really sick with the flu. So, we want people to be proactive. We want really for folks to take their health into their own hands and get the flu vaccination ahead of time to really ward off any potential complications or illness that could really, put themselves out of work, could also potentially spread to their children or their elderly parents.
Most people that die from the flu, that 36,000 number I was talking about, do they die directly from the flu, or normally they have some other ailment, or they're frail in some way?
Sure. So most people they don't die directly from the flu. Generally what happens is, particularly when you're talking about those high-risk categories that I mentioned before, when they get the flu, your body becomes weakened, your immune system may become weakened, and generally what happens is there are secondary complications that occur. So for example, if you talk about asthma or perhaps a patient or a person with a chronic disease like lung disease. When they have the flu, their defense systems become even more weakened, and then secondary infections can take over. So, a pneumonia, for example.
You mentioned asthma again, re-emphasizing that I have to get my son his shot. Thank you so much for that
Absolutely.
and for being on the show. Shannon Davila, again, is the director of the Institute for Quality and Patient Safety and an infection prevention specialist at the New Jersey Hospital Association. When we come back. It's that time of year again where pumpkins are everywhere and in everything. Why are Americans obsessed with pumpkins? Dawn goes out into the fields to find out.